The ASCOT ER for Older People is an easy-read adaptation of the Adult Social Care Outcomes Toolkit, also known as ASCOT. ASCOT is designed to capture the aspects of quality of life most impacted by social care. This new accessible version is designed to support the inclusion of people who find completing surveys tricky due to dementia, mild cognitive impairment, being unfamiliar with surveys or other issues. We hope it will help more people share their own experiences and views.
But why does reporting social care outcomes matter? Well, outcomes are a way of telling us whether services and support are making the right kind of difference to people's lives, helping them to live well. This is important when making decisions around how social care is funded, organised and delivered. It can also help us understand what works for different groups of people and whether services and support are working as well as they could.
So when we first developed ASCOT with older people using home care, the needs and characteristics of people drawing on that care and support were quite different. Due to funding cuts and tightening eligibility criteria, people now receive social care later and levels of cognitive challenges are higher. And this can lead to fewer people being able to give their own views on the care that they are receiving. So we wanted to enable more older people to complete the questionnaire themselves so that they can tell care providers, policymakers and researchers how they feel about the social care services that they receive. So in a past study, back in 2018, we developed and tested an easy-read version of the ASCOT for people with learning disabilities and autism. And we did this specifically with the help of this group of people, and it was successful. Now afterwards, we began to get lots of requests, particularly from service providers, to use this tool with older people who might struggle with standard questionnaires, especially those with mild or moderate cognitive difficulties.
A group of older people, primarily those living with dementia and their supporters or carers, came together as a working group to adapt an existing version of the toolkit for their own age group. We did this over 6 working group meetings, spanning a total of 20 hours, as well as 3 rounds of testing with a total of 25 people supported by social care services who find questionnaires difficult to complete. On the screen, you can see just 3 of the many versions of the toolkit question, this one on food and drink.
Now we think, and what we hope, is that we've created a version of the ASCOT which is much improved for older people accessing social care services and who may find completing surveys tricky due to either dementia, mild cognitive impairment, just being unfamiliar with surveys or any other issues they may have. So our new tool is more relevant, more understandable and easier to respond to than ever before for this group of people. So this has been done by changing the wording of the questions, the order of the questions, the presentation of the questions and how you answer the questions, all on the basis of the working group suggestions and findings from testing with people who can find surveys difficult.
This is what working group members said about being part of this project.
I enjoyed the twists and turns of the research. That's been, for me, a new experience and a really pleasurable one as well. Yeah.
Very interesting. To see how a project is developed, to be involved in a project, meeting other people.
I thought it was interesting seeing how much work goes into producing and changing questionnaires and worksheets. I didn't realise that the whole process was so lengthy, so that was interesting.
I liked the way in which the group worked together, bouncing ideas off each other. It doesn't always work, but it did really work very well with this particular group. And I think it was very creative. It taught us, each of us, I think we learned something from somebody else's perspective.
It saved my life. It made me look, I have Alzheimer's and I thought it was the end of my world. But I've just realised it's not. This is just the beginning of a different world. And coming to this was the first step of that. And it's been really life-changing.
I think those who receive the toolkit it would be wise for them to know that it was constructed in conjunction with people who have a diagnosis of dementia. And in fact, the contributions of those with dementia were fundamental in what that person is receiving.
The ASCOT ER for older people can be used by anyone wishing to measure the impact of social care on older people's quality of life. At the individual level, it can be an opportunity to review how well services are meeting the person's needs and potentially feed into care planning. For organisations delivering care and support, local authorities, commissioners and the regulator, individual data can be aggregated and summarised to better understand whether services and support are working as well as they should. For example, it can be used to identify areas for improvement and demonstrate a commitment to continuous quality. All of it underpinned by a focus on a key social care outcome, quality of life. You can find the new toolkit along with the wider suite of measures and resources to support their use on the ASCOT website.